My name is Sharon Downs. I'm the director of the Disability Resource Center at the University of Arkansas at Little Rock. I wanted to speak with you today about documentation requirements. You know, things have changed a lot, even just in the last year. In 2012, AHEAD came out with new guidance for documentation for DS offices, Disability Services offices. And it's really changed how we approach things. For those of you who may be new to the field, let me give you a little history. This is how it's worked in years past, up until, for a lot of folks, until last year. And that is, the expectation was that when a student shows up in your office, they have in their hands an evaluation from a physician or a psychiatrist that states their disability, has the DSM code on it, and talks about the implications for higher education, gives all the test and subtest results, and it's dated within the last 3 years. And so students, that's just what they're expected to do when they come to a university setting to request accommodations. Disability offices, DS offices around the country, have set up their standards with that same setup in mind. And so their standards generally have stated documentation must be within the last 3 years and meet all the other requirements that I already mentioned. So what AHEAD has done is added some new guidance in 2012 that really flips things around. And this is the new way to approach documentation within your department. In the old system, a student would have the documentation, and we would have that information. We would have the information from our interview with the student, the old, what they called intake interview, and then we'd have the student self-report. So we'd have all three of those items. But with the new guidance from AHEAD, we're really taking those same three elements and we're just flipping them around in order of importance. So what the new guidance states is that our primary source of information needs to be the student. So the student who comes in to meet with you, they are the primary source of information about their disability and about any accommodation requests that they may have. Because nobody knows that student's disability better than the student themselves. You know, the evaluator who may have met with the student who wrote the report probably met with that student for maybe an hour. The interview that I have with the student may last maybe an hour. So that's 2 hours out of two people's lives. Whereas the student themselves have been living with that disability from birth or until that disability was acquired. And so they really are the expert on their own disability. So we're taking those same three elements and we're flipping them around. The primary source of information now is the student. What the student is telling us about their history, about accommodations they've received in the past, about their experience in the post-secondary education and barriers that they have experienced or that they anticipate. The second source of information, the secondary source, to use the terminology in the AHEAD guidance, the secondary source is information that we gain from that interaction with the student. So if a student's in my office and we're discussing something back and forth, I can notice things that either the student is doing or saying that kind of supports what he or she is telling me. For instance, if a student says, I have a very difficult time finishing my tests, and I ask why, and perhaps that student can't even really articulate why. So that primary source of information sometimes isn't there. Sometimes students are not great at articulating their specific information at any given time, like any of us, I guess. But on the secondary piece, just in observing, what I see with that particular student is a lot of fidgeting, a lot of clicking the pen on the lap. The student keeps taking us, well, in the South we call it chasing rabbits, you know, taking me down a path, a different path, and I have to kind of help the student get back on the discussion that we're having. And so in that interaction, I can see a lot of things going on that then I can say, you know, I can kind of see now why test taking might be a barrier for you. So you have the primary, what the student is telling you. The secondary, my own observations, because I'm somebody who's in the field who's worked with a lot of students, and so I can pick up on a lot of that. And then the tertiary is any external documentation from a physician or psychiatrist. So you see it's the same three pieces, it's just flipped around. Now, often, just with the primary, and certainly with the primary and the secondary, the interaction with the student, I get all the information I need to engage in that. This is called the interactive process with students, which is what the ADA Amendments Act requires of us, to go through an interactive process. With no external documentation whatsoever, very often the student and I can identify barriers and come up with solutions, whether they be making adjustments to the academic environment in which they're interacting, or whether it be putting specific accommodations in place. If what the student is requesting as far as accommodations and what the student has told me and perhaps my observation of the student, if they just don't jive, if what they're requesting doesn't make sense in the context of the first two items, then at that point we can talk about external documentation to see if we can get the information from perhaps a physician or a psychiatrist or an old IEP report or any other external documentation that would help supplement what we already know from the first two items to fill in the gaps of knowledge that we have. But what the AHEAD guidance from 2012 very clearly tells us is that we can no longer unilaterally require external documentation from students. Honestly, I say we can no longer. We never could legally do that. That was the practice in our field, but we never could legally do that. The ADA Amendments Act, however, made that crystal clear, that that is not a legal practice, it's not an ethical practice. The only purpose of external documentation is to fill in the gaps of knowledge that you need to make sense of between the student's story, your own observations, and any specific accommodation requests that the student is making. You need just enough to fill in that gap. So for instance, if a student tells me, I have paralysis and therefore I need extra time on a test. I'm paralyzed from the waist down and I need extra time on a test. I'm thinking, I'm not sure that really makes a lot of sense. And perhaps I'm able to get the information from the student. For instance, if I were to ask questions like, are you taking any medication? And they say, oh yes, I'm on hydrocodone 3 times a day. Oh, well, how does that make you feel? Oh, I'm very groggy and it's hard to keep a train of thought. Then all of a sudden that makes sense why they would need extra time. But perhaps the student isn't able to clearly articulate even that. In that particular instance, I would want external documentation just to fill in that little gap of knowledge. A student doesn't have to go get a complete assessment and evaluation done to satisfy that need. They just need to get maybe a note from his doctor that could address that question. That would be all that I would need. So our responsibility now is to welcome students in, go through the interactive process, and only when absolutely necessary request external documentation. Because again, the real expert on what's going on with that student is sitting right in front of you.